Delta Airlines CEO Ed Bastian wrote a memo to his employees outlining his tough approach towards unvaccinated workers. Bastian said in the blog post, "Since the earliest days of the pandemic, our #1 priority has always been to protect our people and customers, and today I'm pleased to announce that we've reached the milestone of 75% of our people vaccinated, which puts us one step closer to getting back to what we do best, connecting the world and running the best airline on the planet." He then laid out his plans. Delta's plans are in line with many media outlets, private companies and public entities. Their collective logic is that since the FDA approved Pfizer's vaccine, workers who were hesitant about getting their shots should now get vaccinated. They've also called for making the lives of the unvaccinated difficult in an effort to nudge them towards getting inoculated. The airline industry's business model is highly susceptible to the disease. Their passengers sit tightly together in a confined space for long periods of time. If potential travelers are concerned about contracting and spreading the disease, they'll balk on booking a trip. Business people will elect to hold an online Zoom meeting instead of flying out to meet a client if there is a serious health risk. Some airliners have already reported revenue is trending lower than forecasts, an increase in cancellations and profit warnings attributed to the sudden surge of the Delta variant. Healthcare and hospital costs are a big exorbitant issue too. The extra monthly surcharge is needed to defray the expenses of enhanced insurance bills, Bastian contends. The airliner points out the hospital charges could run to $40,000 or higher for COVID-19 patients. The rate of people catching the virus has been rapidly growing. U.S. COVID-19 hospitalizations hit 100,000 to mark the highest level since January. CBS News reported that health insurance providers are now asking people who contract the disease to share the cost of treatment, which can get expensive if it requires a lengthy hospital stay. An analysis by the Kaiser Family Foundation found that in November 2020, nearly 90% of insured individuals would have had their out-of-pocket costs, including copays, coinsurance or payments toward a deductible, waived if they had been hospitalized for COVID-19. Now it's different. According to CBS News, early in the pandemic, most private insurers waived cost sharing for patients under their plans or even covered the full cost of treatment. Now that the FDA has approved a vaccine and effective coronavirus vaccines widely available, most insurers are no longer waiving those costs. Once again, costs come into play. By helping out with the hospital costs, it has a backfiring effect. The financial aid is actually a disincentive for the vaccine holdouts to get their jabs. Now that it will come out of their pockets, non-vaccinated people may reconsider their stance.